Hello and welcome to today's episode on segmentation analysis. We repeat the calculation setup from Wolf Limited, where you define the margins of the vocal folds. In the middle, you have the quantitative measurements of the opening quotients of the front, middle, and rear part of the vocal folds. And in the bottom, the single movement of the middle of the vocal folds are illustrated. In this picture, the single movement of the vocal folds in the front, middle, and rear are shown. This is a normal voice. In the next, you see a pathological voice. To illustrate what segmentation analysis can be used for diagnostically in the clinic, we show a picture from a presentation on a dystonic patient with spasms. The top curve is a segmentation of both rear, middle, and front of the vocal folds. They're added together in an overlay. We also include some of the other analysis tools that we have discussed in earlier videos to show how it can be used in the clinic. We have both area, audio, electroglottography, and chromatography all shown in time to help give a nuanced picture of the voice of this patient. This study is interesting and one of the earlier ones using high speed digital imaging. It includes a description of adductor spasmodic dysphonia, but the results again is without numerical values, which is needed. Many papers in recent years discuss the possibility for quantification measurements for the vocal folds. Glottal area waveform is the focus in most cases, like in this overview. Trajectories is a possibility. There is another aspect of quantitative comparison of the acoustic sound to all of these quantitative methods that needs to be discussed. This is the presentation of glottis analysis tools from Erlangen on their webpage. We have tried many kinds of quantification on all the parameters offered from Erlangen in glottis analysis tool. They divide in acoustical analysis, glottal area waveform, and trajectories. In 2017, at the International Federation of Otorhinolaryngology Society World Conference, we presented a work where our statistician Martin made a huge calculation of 183 parameters in this glottis analysis tool on 12 persons who had complaints of hoarseness and 12 without complaints. Here are some of the results comparing 12 normal persons with 12 persons with complaints of hoarseness in a prospective case control study. They show no statistical significance. We searched British Library for quantitative measurements of the vocal folds, and only two papers were found between 2012 and 2020. The paper on the left focuses on canines, but what is interesting is the authors tries to combine an understanding of tissue and function. This is probably where we are right now, that the acoustical segmentational results are totally dependent on the state of the tissue. That is why we are on a team trying to develop optical coherence tomography for tissue measurement. These two studies involve the aspects that have been overlooked for many years in models and quantification of the vocal fold function. It is illustrative to the scale of the problem that even in 2017 they have to use animal studies. We have until now made plans of ultra high resolution optical coherence tomography, especially for reflux patients, but also for online measurement of optical coherence tomography values of the vocal folds during movement. The equipment is under development. The difficult part is also to make a stable probe. There's a lot of discussion of intranasal fibroscopes, but we think till now that a stiff probe through the mouth together with high speed films would give us enough quantitative results. This study investigates the influence of spatial camera resolution on quantitative vocal fold vibratory function parameters obtained from the glottal area waveform. The use of cameras with high resolution is recommended to analyze glottal area waveform measures on high speed video data. Visual and automatic evaluation of vocal fold mucosal waves through sharpness of lateral peaks in high-speed video chirography images is demonstrated in this paper to the right. We only found 2 papers with quantitative digital chirography in pathology after 2012. Note how the quantification is made. Thank you for watching, and we'll see you in the next one.